Ua wairea te one tapu, ka hura tangata auta te turaki atu ki tangata atai, ka hura tangata atai te turaki atu ki tangata auta, pērā hoki rā te korepe nui, te korepe roa te wāhiawa, te toitoi awa whakamau ātama ki te ara, whakamoetama ki te ara no tūnorongo, whanno, haramai te toki, haumi e, hui e, tāiki e. Ko ngā tāpaitanga ki te wāhi ngaro, te tīmatanga te whakaotinga o ngā mea katoa, ki a rātau kua mene atu rā ki te pō, te pāpara John Tuari, te uri o hauiti, e takoto mai nai te poho o tō whare, haere atu rā koutou, te kāhui wairua, haere, tahi tonu atu rā te kōrero haere, oti atu. Hoki mai anō rā ngā rārangi kōrero ki a tātou, te hunga ora, e pai nei, nau mai, haere mai, ki tēnei whare kōrero o tātou, nau mai ki tō tātou webinar, e mihi atu ana, tau mai rā. Welcome everybody and thank you for joining us today for our webinar, Ka ora, ka ako, what is the evidence that healthy school lunches are worth investing in? My name is Kauti Wakeford, and it's a pleasure to welcome you on behalf of the team here at A Better Start National Science Challenge, the hosts of today's webinar. A Better Start National Science Challenge is a national collaborative research program working to help children achieve the best possible start in life. Its mission is to find practical, evidence-based solutions that make a measurable difference for tamariki, specifically in the areas of healthy weight, successful learning, and mental health and resilience. A Better Start National Science, A Better Start is just one of the many organisations lending support to Ka ora, ka ako's mission of providing meals to children across the country who might otherwise go hungry. Among those lending a hand are the University of Auckland, Eastern Institute of Technology, Te Kura i Awarua, Nourishing Hawke's Bay, JK&A, Synergia and Health Coalition Aotearoa. E mihi ana ki a koutou ngā ringa hāpai me ngā kaitautoko. Amidst recent media speculation regarding the effectiveness and cost efficiency of school lunches, today you'll have the opportunity to hear directly from 3 leading researchers about their investigations into the benefits of free healthy school meals. Before we start, a little housekeeping. Today's webinar is scheduled for 1 hour, including Q&A. The webinar will be recorded and loaded onto the website at www.abetterstart.nz, so you can listen again later or share far and wide. So our government can hear. All audience members will be automatically muted throughout the session, and there will be a Q&A, as mentioned, session at the end of the webinar today. Please submit questions that you have through the kōrero using the Q&A function. I don't believe you have access to the chat, but please, any questions you do have, input them into the Q&A function located at the bottom of your Zoom window, and our team will field those questions to our speakers. So without further ado, our chair for today is none other than Professor Barry Taylor of the University of Otago, Deputy Director of A Better Start National Science Challenge. E te rangatira, e te hoa, e Barry tēnā koe.
Yeah. Kia ora, everybody. Thank you very much for attending. Free school lunches has certainly been in the media and very controversial at the moment, so it's opportune that the Better Start National Science Challenge would actually sponsor this webinar. In that we have been funding a lot of evaluation because the Science Challenge was keen to actually see that a program that was actually funded by the government was evaluated not only by the government, but also by some relatively independent researchers. So it's my pleasure to chair the meeting and introduce the speakers. We're going to have 3 speakers. The first is Dr. Kelly Garton, who is a research fellow at University of Auckland School of Population Health. She's got her research focus is on healthier food environments, and she is going to summarize the evidence so far on the program in New Zealand, and then combine that with the evidence that comes from the international literature. So it is my pleasure, Kelly, to pass over to you for the first session.
Thank you, Barry. It's a pleasure to be here today to speak with you all. Get set up here. Okay, so I'll start by giving a brief overview of the program. The Ka ora ka ako pilot project was initiated to help reduce food insecurity under the Child and Youth Wellbeing Strategy in 2019. In the context of high food insecurity, poor child nutritional health, and low and declining educational achievement in Aotearoa, New Zealand. It was designed as free, healthy, daily, and universal, meaning the same meals are provided to the whole school to avoid stigma. And specific objectives, as described in cabinet papers, are alleviating hunger, improving diet quality, reducing barriers to education, and boosting local employment. There are 3 models of delivery. In the internal model, food is prepared in school by staff in school kitchens. The external model, where food is brought in by a local supplier or caterer that's made offsite, and an iwi and hapu model, where food is produced on the marae and distributed to schools in the community. Menus are individually determined between schools and suppliers, but they do need to meet nutrition requirements developed with the Ministry of Health. And finally, schools are encouraged to move towards a zero waste policy. The pilot was rolled out in 3 stages in primary and intermediate schools in 3 regions in 2020. And using the COVID economic recovery funding, the program saw a massive expansion to reach 1/4 of students from late 2021. And school eligibility is based on the equity index. So it's designed to reach those students facing the greatest socioeconomic barriers to school achievement. In 2023, the budget funded Ka'ora Ka'ako to continue until the end of 2024 with an allocation of $323.4 million. And in that year, more than 230,000 learners received daily lunches in almost 1,000 schools. The cost per lunch in 2024, covering food, preparation, delivery, and paying staff, was between $556 and $862, depending on the age group and delivery model. This is because the external model costs a bit more. They have a different operational agreement, and the different tiers reflect the different portion sizes needed for students of different ages. There's also a living wage requirement, and all staff preparing the food or involved in the food delivery has to be paid at least $26 an hour. Now, when measuring the effects of the program, we don't use a traditional linear model because it encourages a narrow definition of cost benefit, and it misses the complexity of a program like this. So our model, shown here, shows the individual child or akonga learner nested within the interpersonal level of their whānau or household, both situated within the institutions, in this case, the school or kura that they attend, the community in which they live, and then more broadly within the food system. And these levels are interlinked. The effects flow both ways between them. So for example, children are influenced by their family and school environments, as well as their community and the food system. But likewise, an intervention targeting a child will impact their household and more broadly their school and community, and eventually the food system at large. And there will also be multiple feedback loops of influence between these different levels. So when assessing the impact of an investment, like a healthy school lunch program, we need to consider the effects at these different levels and over a sustained period of time. And the program has only been running at scale since 2021. So there hasn't been enough time to measure its full or long-term potential. And not all potential outcome areas have been measured. Commissioned evaluations, which I've listed here, have been able to look at various measures of effectiveness, like students' hunger, health, well-being, and attendance. And then independent qualitative studies have looked in depth at how students, whānau, and school staff perceive the program. So as I'll show you, we have a wealth of domestic evidence telling us that the program is having multiple positive effects or outcomes at different levels of impact, and it's heading in the right direction to achieve more over time. But for a lot of the wider benefits we expect to see, it's too soon to evaluate. So to help fill these gaps, these evidence gaps, with the best available evidence and information, we've looked at the international examples of universal school food programs that have run over longer term. Again, universal meaning that it's provided to every child in the school. For example, those found in Sweden, Scotland, Japan, South Korea, and the United States. To do this, we did a massive review of the global evidence base, again, looking specifically at international school food programs that feed all students within the school. And we screened all of this research for quality or strength of evidence. Some are systematic reviews, which pool the findings across several individual studies, and this is considered very strong. Where those reviews aren't available, we've had to look at individual studies of individual programs and make sure that the evidence is credible and relevant to the New Zealand context. And for any of the specific references, these are available in our published papers that I think are linked in the chat. Jumping now to our findings. Official evaluations have measured large reductions in hunger at school for ka ora ka ako learners, especially for food insecure students. They've also found that students are eating more nutritious food. So the lunches are providing at least a third of most nutrients kids need to thrive. And students are eating more vegetables and fewer snacks and sweets at school. In addition, there's qualitative evidence and anecdotal reports of some improvements in eating habits and opportunities for food cultural practices. And when we compare this to the international research, this is consistent with a strong evidence for reductions in student hunger and food insecurity in programs in other high-income countries. There's also some evidence suggesting that children's eating behaviors may improve long-term, but this evidence is less certain. When compared to their peers in other schools and kura not receiving the lunches, ka ora ka ako students experienced large and significant benefits to mental health and well-being. So for an average of a 6% improvement across the board, but especially among food insecure students who saw about a 14% improvement. Ka ora ka ako students also had improved emotional functioning and a small but significant improvement in social functioning, which refers to how often they had problems with friendships, getting along with and keeping up with peers, as well as physical functioning, referring to having the energy and ability to undertake a range of physical activities. They also measured better on the health quality of life scale. So this is an internationally validated tool covering a range of well-being factors. International literature supports the mental health outcomes that we've seen here. And the literature has also found potential beneficial effects on children's weight and height, weight and growth over a longer period of time. And also 2 longer-term studies have found positive impacts on former students' health status later in life. Ka ora ka ako improved attendance for the most underserved learners, amounting to an average 3 extra days of school attended per year, but another 2 days per term for the 10% most underserved students. Achievement in school has not yet been evaluated against ka ora ka ako lunch provision. So the interim and impact evaluations didn't collect data on learning, but the kapapamari evaluation of the iwi and hapu model reported an improvement in attention and focus. So they found that akonga were better able to concentrate, engage with class material, and enjoy the learning experience. And this echoes the qualitative evidence that's been found from primary and secondary schools in individual studies. The impact evaluation of the program measured school functioning as a component of well-being. So they assessed the frequency at which students struggle to pay attention in class, forget, have trouble keeping up, or were away from school due to sickness or doctor visits. So they found that the ka ora ka ako program resulted in improved ability to function at school for all learners when compared to their peers in other schools in Kura. So this was a 3.6 school functioning advantage across the board, with the program contributing a 20% school functioning advantage for the most underserved learners. And again, looking internationally, a systematic review of 47 studies examining universal school free lunches reported that most of these have found positive associations with students' academic performance. However, findings are more mixed when looking at attendance as an outcome. So either it's having a positive effect on attendance or none at all. And in terms of long-term impacts, a study that followed the primary school lunch program in Sweden over 10 years found that for each year they were exposed to the program, students ended up staying in school longer and being more likely to start post-secondary education. Moving to the household level, kids are reliably getting at least 1 healthy meal per day, 5 days a week in the school term, which is consistent with the definition of food security. We also know that household savings on the grocery bill are between $1,000 and $5,000 per year for those who were formerly buying food. And qualitative studies have consistently found reduced hardship, food insecurity, and time burden for whānau involved in the program. The international literature strongly supports these findings, with very strong evidence for reductions in household food insecurity in other high-income countries. And studies in the US and Sweden that followed programs over time found long-term impacts for recipients in terms of their adult income and education, which improved equity through social mobility. And moving up to the community level, 2,455 jobs had been created or retained as a result of the program as of 2022. And more than half of these jobs were full-time and all paid a living wage. There are more than 180 business providers, and Māori business providers supply 126 schools, while the iwi and hapu model supplies 40 schools. The international literature from high-income countries supports evidence for this boosting the local economy. For instance, a school lunch program in Scotland that integrated local, small-scale, and organic producers had a substantial economic benefit for these local suppliers, and a social return on investment was estimated to be £6 returned for every £1 invested. In addition, the iwi and hapu social procurement and partnership model was found to realize a range of benefits for the community related to relationship building and resilience, rangatiratanga, social equity, and economic opportunities. So this was observed for the iwi hapu model specifically, but many of the community level benefits come from all delivery models. And because Ka Ora Ka Ako is a national scale program, the social procurement model and other built-in requirements, like the nutrition standards, have ripple effects throughout the food system. Supplier surveys and studies in Ka Ora Ka Ako schools have noted evidence of companies reformulating certain products to meet nutrition standards and to reduce their packaging. So this leads to new, healthier, and more environmentally sustainable food products available. For example, bread and bakery companies have changed their recipes to make sure they meet nutritional requirements. There's also anecdotal evidence that the volume of food produced and distributed has also incentivized investment in reusable packaging and composting facilities. Now, international studies have very rarely examined food system effects, but there are some notable examples from Canada and Scotland again, showing reductions in food miles and increased resilience to shocks. And finally, research across the board has reinforced the importance of a whole of school approach. The evaluations done domestically have highlighted that the benefits extend to all children involved, enrolled in Ka Ora Ka Ako schools, though those facing the most challenges do benefit the most. And qualitative research with students and whānau finds that the whole of school approach is mana enhancing and promotes self-esteem. Children build social connections through eating the same foods together every day, and it supports them broadening their taste preferences for healthy foods. They're being encouraged to try new things. A large body of international evidence shows that targeting food assistance to so-called needy kids creates stigma and low self-esteem. It reduces the uptake, which in turn increases waste, and it compromises the learning and academic performance potential for all students. It also tends to increase the frequency of behavioral incidents at school. So in summary, a wealth of domestic evidence shows that Ka Ora Ka Ako is having a positive effect in line with its objectives at multiple levels of impact. There is strong and credible international evidence that indicates that these outcomes will allow the program to realize substantial impacts at scale over a long time period if the investment is sustained. And finally, a whole of school approach is critical to ensuring these benefits are realized. Thanks so much.
Well, Kelly, thank you very much. That is a really nice to see this data coming out, and much of it was new to me and really interesting, and I'm sure a wide audience should be looking at it. We'll move on to the next phase of the talk. So that's coming from Pippa McKelvie-Sebileau. She is a founding member of the Nourishing Hawke's Bay group or research team. She finished her doctorate in 2023 at the University of Auckland, and she's currently a research fellow at the Te Kura Warua Research Centre at the Eastern Institute of Technology in Napier. So she is going to look more at a very specific connection that has come clear now about the impact of hunger on school achievement using findings from large international studies. So it's my pleasure to ask Pippa to take over. Thank you.
Thank you, Barry. Kia ora koutou katoa. As Barry said, I'm part of the Nourishing Hawke's Bay He Wairua Tō Te Kai team based here in Hawke's Bay, and we have been researching the impact of the school lunches since 2020 when they were introduced here in Hawke's Bay as a pilot region on day 1 of term 1 2020. And we look at the impacts for the student and the community and the schools, as Kelly said. But in all of that time, we have not seen any evaluation, any direct evaluation of the impact of the school lunch program, Ka ora ka ako, on students' learning. So with the current review happening and the discussions around the need for evidence around the impact of school lunches, we thought it was important to go out and look for evidence that might exist elsewhere in other studies. And so what I'm sharing with you over the next 10-15 minutes is evidence from large-scale international assessment that are now looking at the impact of hunger of hunger for our New Zealand students on their learning. So the first study that I'll share with you is the PISA study, the Program for International Student Assessment. PISA is the largest study that New Zealand participates in at an international level. There's around 90 countries who participate, and it's been running every 3 years since 2000. So we now have over 2 decades of practice of participating and analysing that data. And it studies 15-year-olds' achievement in maths, reading and science, linking it back to factors at the student level, wellbeing, practices after school, those sorts of things, at the home level and at the school level. You see it in the media a lot every 3 years because it kind of publishes these ranked countries. And what's important for New Zealand is our rank within the OECD, so comparing developed countries like ourselves within the OECD. It aims to be a policy tool. So that what I mean by that is that it aims to share what's working across the globe and to bring that into practice at the educational policy level or at the policy level more broadly in countries. And it does aim to be real-world learning or real-world problem rather than curriculum-based testing. So interestingly and importantly for this, in the 2022 round, which was published last year in December, for the first time they asked students about food poverty. So students across the world were asked how many times per week they miss a meal due to lack of money. So, and here I'm sharing with you New Zealand's results. So the frequencies of students experiencing food poverty. You'll see there that we had the second highest rate of food poverty in the OECD. So there was around just over 14% of our 15-year-olds saying they missed meals due to lack of money, and that's compared to that OECD average of 8.2%. And almost 6% of students saying they miss meals daily due to lack of money. So if we link that up with achievement now, bringing that in on the same graph over there on the right axis, we have the maths score, so achievement in maths, and that's that blue line that you can see. It drops off really significantly from students on the left who never experience any hunger due to lack of money, and then even if they experience hunger once a week due to lack of money, maths achievement drops off pretty significantly. So to give you a bit of context about the PISA scale, it's a standardized scale. Like I said, it's been in existence for over 2 decades. And as an indication of what that means, 20 points on the scale is approximately equal to an average year of learning. So you can see that those gaps are really quite significant and very large. To put it into those kind of terms, students who are going hungry once a week are already 2 years behind in their maths learning. 2 to 5 times a week, approximately 3 years behind, and if they're going hungry every day, that's a 4-year lag in achievement. So obviously this is for maths. But yeah, sorry, just to summarise what I just said, students in New Zealand who miss meals due to lack of money are 2 to 4 years behind in their mathematics achievement when we compare them with students who never go hungry. And this is from a regression analysis, because obviously the first question we asked ourselves was, well, what's the impact of socioeconomic deprivation? So this, we did regression analyses on these results and we held socioeconomic deprivation constant, and those results that I showed you are after that. So they're just talking about the additional impact of hunger. So obviously we also thought, well, is it just linked to maths? This is where we bring in the yellow line here on the graph for science scores. And you see that exactly the same pattern is occurring. The scores are slightly higher overall in science achievement, but they drop off significantly. So it's not just in math. And further, if we bring in the reading scores, you see exactly the same pattern again. So it's actually across all 3 PISA subject areas, those core areas of math, reading and science. Achievement drops off very significantly as soon as the students experience hunger. And this, really importantly too, PISA allows to look at what is going on in other countries. And so this pattern is not unique to New Zealand. The pattern of achievement falling off as students experience hunger is not unique to New Zealand. What is unique to New Zealand is our high rates of food poverty. So that 14% of students experiencing food poverty compared to 8%. Importantly too, we wanted to look at the impact for ākonga Māori in the study. We know that in the schools receiving the lunches, around 50% of the students are Māori. So here on the graph, you have the overall rates for New Zealand in blue, and in green, those are percentages just for Māori students participating in PISA. And you've got about 1 in 4 missing meals once a week, and about 1 in 10 Māori students missing meals every day due to lack of money. So those rates are obviously quite a bit higher, and again higher to that much higher than that reference point of 8% for the OECD. So if we bring in achievement, again, that's the same type of graph with the achievement score on the right axis over there. This is the math score. The blue line is the line you saw before for New Zealand students, and the green line is for Māori students. So what you see is an overall lower achievement on average, a 50-point difference. And this is further exacerbated. So it's further exacerbated by high rates of food poverty for our Māori students. So obviously then we thought, well, is this just related to PISA? We've seen it across the 3 core areas of PISA. Is it just something that's happening in that PISA study? And no, that's not the case. We found other international studies that in which New Zealand participates. This is the TIMS study, the Trends in International Maths and Science study. And this TIMS looks at different year groups. It looks at the year 5 students about to finish almost about to finish primary school, and year 9 students starting high school. So the percentages here are for students feeling hungry on arrival at school, so slightly different measure of food poverty this time. And you see a higher rate of students feeling hungry. You see about 3/4 of our students across those 2 year groups who feel hungry on arrival at school. Again, we have the ability with these large-scale international assessments to link it to achievement, to link hunger and achievement. So bring it in here on the right axis again with TIMS scores. There's 4 lines there. It's a busy graph, I know, but the blue lines are for year 5 students and the yellow lines are for year 9 students, science and maths each time. And really the point here is to show again that we're seeing those steep drop-offs from students who never experience hunger, having higher achievement to students who experience hunger even just sometimes. So, and then we have a third and final international study that also looks at the impact of hunger on learning. This is the PEARL study, Progress in Reading Literacy study. These data are from PIRLS 2021. Year 5 students feeling hungry on arrival at school. We see those high rates again. It's slightly over 3/4 this time. It's about 80% of students in this study saying they arrive hungry at school, and we see the steep drop in achievement. So you can be excused for feeling like I've kind of hit you with a barrage of graphs, just slightly different in their colours and slightly different in their format. But really, that's what it is. It's that same pattern that we're seeing across these 3 large-scale international assessments. The achievement just drops off really significantly. So we have 3 large-scale international assessments, 2 different age groups. Those year 5 students at primary school, year 9 students at high school. We have 2 different food poverty measures. You have sort of missing breakfast or feeling hungry in the morning, and missing meals due to lack of money. 3 subject areas, but we're seeing the same thing. Achievement drops off as students experience hunger, even for students who are experiencing that hunger or that food insecurity intermittently, and even after socioeconomic deprivation is taken into account with those regression analyses. So the reason why this is very important in New Zealand at the moment is this final graph, this last graph that I'll share with you. This is from the New Zealand Health Survey, who's been monitoring the number of children living in households where food runs out sometimes or often. So you can see this kind of downward trend in the thick blue line, which is all households across New Zealand. This thick blue line has been slowly trending downwards, and it jumped downwards in 2020. And last year, there was an enormous upwards tick of food insecurity for households with children. So that's a 7% increase overall, or for Māori, that's a 9% increase in the dotted yellow line. So this is why it's really concerning. We know that food insecurity is increasing, and we're just seeing such compelling evidence for the impact of food insecurity on achievement. So conclusions are, like I said, hunger is a really significant barrier to learning. And if we keep in mind the goals of Ka Ora Ka Ako to remove barriers, I think that's very important to consider. Food insecurity is not unique to New Zealand. It's rising across the globe. But we have a particularly high rate here in New Zealand, particularly high compared to our OECD counterpart. And Ka Ora Ka Ako is removing this barrier to learning. So we think that's really important. So just to finish, I really want to say thank you to the analysts to our the Better Start National Science Challenge, and to the analysts from the Educational Measurement and Assessment team at the Ministry of Education who helped with these analyses and accessing the data from these assessments. Thank you.
Pippa, thank you very much. That was a rapid run through a lot of information. Actually, much of it all saying the same thing, and important to sort of take that in as we move to listening to Boyd. Now, Boyd Swinburn is well known across New Zealand. He's on TV quite a lot. He's a professor at the University of Auckland, a professor of population nutrition and global health. I remember him from back when he was actually the medical director of the Heart Foundation. So he's moved around back to Australia and back to New Zealand and been heavily involved in this particular program. So he is going to talk to us about what the effectiveness, economy, efficiency, equity, cost effectiveness of the Ka Ora Ka Ako program. And we'll use a structured approach to this, which I think will help us look at the broad consequences of the program. And it's my pleasure to ask Boyd to take over now. Thank you.
Good, thanks, Barry. Kia koutou. So I'm going to talk about an approach called value for investment, this analysis of Ka Ora Ka Ako that we have been undertaking. And this has been funded by National Sciences Challenge, part of Nourishing Hawke's Bay project. And this analysis system developed by Dr. Julian King, who's been part of the team and guiding us through this approach. I should point out that we're sort of partway through this process, so what I'm giving you is preliminary results. We've had 3 workshops with community and with government stakeholders to determine what we mean by value and the criteria for measurement and judgment and so on. We have then gathered the evidence from all of those evaluations that Kelly talked about, and I'm going to present some preliminary findings. We still have workshops to go to get those validated by stakeholders. So just to remind you of the purposes of Karo Kako from the Cabinet papers, those 4 areas: alleviating hunger, in the end to reduce material hardship for households, improving child nutrition, in the end to get some influence on health outcomes, increase the quality and job opportunities to help with COVID recovery, as is COVID funding, and reducing the barriers to education, in the end to improve educational attainment. So this is a bit of a busy slide, apologies for that, but just to show you this 8-step process for value for investment. So first of all, we work with the stakeholders to understand the program and to develop this value proposition. What is the value that the stakeholders feel is important for the program? And then we develop these criteria about how you would measure them across these 5 E's, which I'll talk about. Develop the standard, gather the evidence in steps 4 and 5, pull that together, create an assessment of the evidence, and then do these evaluative judgments. And as I said, these evaluative judgments have been made by the research team, but they've yet to be validated by the community. So this is quite a busy slide, but just to show you all of the bullet points, the summarized bullet points that came from these Hawke's Bay and Ministry of Health and Education workshops, clustered around improved health and wellbeing, learning outcomes, improved local economies, communities, and environmental sustainability. So the environmental sustainability is what stakeholders were wanting from the program in the future, although that has not been incorporated in the original purpose of Karo Kako. And the value statement, the value proposition is there at the bottom, a big long sentence about what we expect from this program, which is a lot. There is high expectations from this program, and the question is it delivering? So we took those bullet points and converted them into this structure here, the 5 E's. So most of what the community talked about sits here within this effectiveness group here. So you see there's quite a few effectiveness criteria that the community wanted Karo Kako to produce. But there's also, from the point of view of a government funding this, they also want to know that the program is economical, is the other resources being well stewarded, is it efficient, is it serving equity purposes, and what's the overall cost effectiveness. So I'm going to go through some of those with you. I'm not going to go through the whole 21, but just to say that with each of them, there are kind of multiple indicators, and this is how we make the judgments about poor, adequate, good, or excellent. So excellent is if we're meeting or exceeding reasonable expectations. There is still room for incremental improvements, but the program is meeting expectations. Good means it's meeting some expectations with some room for improvement. Adequate, not meeting all expectations, but meeting minimum requirements, and poor means not fulfilling minimum requirements. So this is the summary slide, which I'll finish on at the end, but this is the sort of scorecard, if you like. The ones in red relate to the fundamental purposes of the program. Now, those of you keeping a close listening ear on David Seymour will note that he focuses very heavily on the educational outcomes, but that's not what was just in the cabinet papers. There was a bigger variety of expected outcomes and various aspects of the economy, efficiency, equity. So you can see 12 out of the 21 we've rated as excellent, 4 good, 4 adequate, and 1 poor. So I'm just going to pick some of those outcomes. I'm not going to talk about effectiveness because Kelly's done that very well. I'm going to pick some of the areas from the other ones, but when we send the slides around, I'll have the summaries for all of those indicators, all those domains. So the economy, is this program buying inputs appropriate quality and the right price? And so here we looked at the government procurement policies and multiple internal policies as well. And you may not be aware, but the procurement policies that government has want to achieve broader outcomes than just getting the cheapest product available. And they involve involving New Zealand businesses, including Mare and Pacifica, ensuring that there's living wage, assessing and reducing greenhouse gas emissions. So this is a very forward-looking set of procurement policies which take a wider view than a strict best bang for buck in money terms. And there's all those internal policies as well. So that was rated as excellent. And also the second part of the economy is trying to achieve a fair balance between the cost to the government, the cost to the taxpayer, versus what's the quality of the lunches, how well are the staff being paid, and the profits for the providers. So again, this was rated as excellent. The ministry keeps a complaints register, and you see these are very low, 88 and 201 out of 1 million lunches served per week over the last 2.5 years. So very rare sets of complaints, and the system really is shaking down to be performing quite well, I think, or very well. Employment, at least at a living wage, they do a close collaboration every term on the pricing of the lunches, and there are flexible options for small providers. On efficiency, this was the first one was the only one that rated poorly, and this is the uncertainty around the continuation of the program. And this is absolutely front of mind in every school and in every provider around the country at the moment, because they have no certainty beyond the end of this year. And that is a big barrier to achieving efficiency. They're not investing in the systems or the people or the supply chain or equipment to improve efficiency because the term of funding is very short. So if this budget shows longer term commitment, then I'm sure we'll get better efficiencies. And the productive delivery, again, you can see the incident reports down here, 5691, very low incidence of late deliveries or food safety issues, and both schools and suppliers rating the program highly for success. There's been quite a bit of discussion about waste, and we need to differentiate here between food surplus and food waste. So, oops, all right, let me go back to food surplus. So food surplus is the untouched lunches. Now that did get up to about as high as 14%, but now it's around about 11% as reported by the schools. As reported by the providers, it's around about 5% or less than 5%. So somewhere between 5 and 10%, and that seems to be about a good public sector, public service sector target, around 7%. So they have been high, and that is now improved. They're much more closely monitoring the numbers of kids at school with the number of lunches that need to be delivered. So those systems are now much better in place. We don't have as good data around food waste and packaging waste that's going to landfill or where the destination of that is, but this is in the new supplier KPIs. Sorry, I should have pointed out, food surplus, these spare untouched lunches, there is good data about where they end up. So the school surveys report where they go, so mostly to students in need or some to food rescue, and from the provider surveys, they say it's stored or distributed by the schools or to food rescue organisations. So I think we can have good confidence that the food surplus is getting to the right place. We don't know quite yet about the food waste, but all providers have to have waste minimisation plans, and there's now lots of resources and guidance for these providers on the website. And equity, How's it doing for equity? Well, across schools, it's a little bit of a vexed one, this one, because with the budget that is available, we believe that the program design is highly appropriate. It uses the equity index, so it's getting the 25% students from those schools with the lowest equity index, and so that's appropriate. But what is really important is that there are many, many children, about 60% of kids that have household food insecurity go to schools which are not covered by the program. So across schools, yes, with the money given, this is appropriately targeted for equity, but a lot of students are missing out. So that's why this was rated as adequate. And then within schools, this universality of design, the provision of lunches for all students to minimize food poverty stigma, is considered highly appropriate. And then lastly, cost effectiveness. This is a tougher one. One of our recommendations is that a formal cost effectiveness evaluation gets done. We know what the investment is, but the monetizable benefits, that analysis hasn't been done. But international evidence from Canada suggests about a 2.5 to 7-fold benefit for the investment. And there's a lot of intangibles. Kelly mentioned the improvement in mental well-being. What price do you put on a 20% increase in mental well-being among kids who are living with food insecurity? So at the moment, we consider this kind of adequate, but more research needs to be done on that. And so I'm just going to leave you with the final scorecard again there. You can see that this is actually a very good rating, I believe, for this program. And I do have to give credit to the Ministry of Education that developed this program, got it running in a very short space of time. And we believe that the program is well supported and has very good economic credentials. So kia ora, I'll leave it there, and thanks very much for listening. Kia ora.
Kia ora. Thank you very much, Boyd. A nice summary, and we've talked about a lot today, and I see that most of the questions that have already come through, the question and answers have been answered, but there's one outstanding, and I might take that to Kelly, just to outline again the main providers of lunch in the school and that distribution between sort of marae, iwi, in-house, and then commercial providers, what the balance is, and perhaps about how do the actual individual schools run it? How much parent involvement is there in the schools that are doing it in-house? Kelly, you might need to unmute and turn on your video. There we are, good.
Thanks, Barry. I'm actually wondering if I could pass this question on to Pippa, because she's been working really closely with Ka ora ka ako schools down in Hawke's Bay, and she has a lot more detail on the implementation.
That sounds good.
Yeah, sure. So there are the 3 models that schools can choose from, and it's up to each individual school to choose what model they adopt. Sometimes that's done by the senior management, sometimes that's done by the board, sometimes that's done with the whole school community. And so they'll choose either the private caterer, a commercial caterer. They can choose to do it in-house, the internal model, where they cook the schools, the lunches on site. And then there's the iwi hapu model as well, with iwi hapu providers. There is another model too that's becoming a little more common. It's when one school cooks the lunches or makes the lunches and provides it to another school. So it's sort of a mix between that internal external model. But parents don't typically get involved, I don't believe. Yeah.
I should just say there's about 1,000 schools being provided, Barry, and about 10% of those are from big, provided by big catering organisations. So 90% of the providers are either in the school or locally based.
Okay, that's important. Thank you. There is another question, but we might just leave it to the end because I've got my own question, which is there was mention in one of the earlier questions about school gardens. And there seems to be, to me, an obvious connection. in children, especially in primary school, learning about growing food and then eating it. Have any of the schools made anything of that connection? Pippa, again.
So maybe,
Yeah, there are a lot of schools that are making that connection. I think that lends itself more into the curriculum, because what they find is that to feed 300 students 5 days a week, with your vegetable garden that's sort of got produce that's on and off, depending on the seasons or depending on what's happening, that gets a bit more difficult because they need reliable supply of it. So when they can incorporate it for those learning purposes with the curriculum, there are lots of schools doing that. And there's programs like Garden to Table, who work with schools who are part of Garden to Table and Ka Ora Ka Ako. But mostly, 3/4 of the schools do get their food provided from external providers, so they don't have the opportunity so much to have school gardens.
and I should say, Barry, also that this is an area of that needs to be worked on, the linking of the program with curriculum. There's a lot of potential and possibilities there, but that's seen as a direction to go in the future rather than strong at the moment.
Right. There's a very interesting question just come up from Gabriella around ultra-processed foods. It's again a topical issue right at the moment. What are the standards set for use or not use of ultra-processed foods?
I'm happy to answer to the best of my ability that the ultra-processed foods as such aren't really written into the nutritional requirements, but in general, ultra-processed foods wouldn't meet the nutritional requirements and standards that have been set by the Ministry of Health. So there should be very low, if any, presence in the lunches.
Yeah, and I'd just like to say to the audience that we hope to have another webinar, National Science Challenge sponsored webinar shortly, of which half of it will be focused on ultra-processed foods and the rapidly emerging evidence about their lack of good for the country. I want to just go to the next one, which is perhaps a discussion from all the participants about how this is paid for. At the moment, the tax is taken out of our taxes, and that the government then allocates the money depending on other priorities. Or are there any other ways apart from a straight tax take to the Education Department that for paying for this? And Boyd would like to answer this, but I might ask Pippa to answer it as well, or maybe all three of you.
Maybe we'll start with Pippa, since she's spent time in France with kids going to the French schools and has experience of that program as well.
Yeah, that's the really just to share personal experience from, there are models overseas that we know work differently, with some students receiving the lunches for free or for a very low cost, and others who pay. And yeah, my 3 children were born in France, where it works on a system like that, based on your tax return. And so you just pay a bill at the end of the month, which is either could be free for some families or more expensive for others based on what the parents are earning. So that's kind of set up administratively, and importantly, the students themselves, the children, have no idea about who's paying what for the food. It's the same food for everyone. They eat together, and the admin happens in the background. So there certainly are other models overseas. Yeah, Boyd might like to add to that.
But how is it accepted at the population level? I mean, what do people think about that?
What do people think about that in France? It's just how it's done. There are a lot of things that are paid on a sliding scale based on your income. You pay also for your childcare on a similar rate like that. So I think it's fairly well accepted that all of the students in the school deserve good quality food, and it is good quality. It's a 3-course meal. It's a very broad range of foods that they're getting. A lot of vegetables. There are plant-based meals. There's a requirement for organic food. There's a requirement for local food in the menus. That's very good food, and parents or families mostly pay for that based on their ability.
That's good. And Boyd might comment, though. I do note that we have a New Zealand chef in France who's just got a Michelin star, so it starts early. Boyd, what do you think?
Well, at the same time as Minister Seymour is saying we need to chop the budget for these lunches, either by chopping the number of students or the number of schools or something. Health Coalition Aotearoa, which I co-chair, is calling for a doubling of it. And in fact, with these economic credentials and the evidence we've provided, I think that's very good grounds for increasing it. And the question then becomes, how does the country pay for it? And I think we don't have a system at the moment like Pippa described, but that's potentially one of the ways that we could go down the track. But this is a program, in my view, for expansion, not for cutting.
Thank you. That makes sense. There's some interesting comments in the question A, some people who are providers talking about how it's done at different areas. So that's worth keeping an eye on. I want to just move to the other great challenge that is facing us, apart from paying for this program for our children who need it, is climate change and resilience to climate change. Our food systems, I know Boyd has an interest in this area, so I'm just going to ask him to comment a bit, because I think our youth are increasingly worried and anxiety levels are going up. A lot of that is around foreseeing climate change as a big issue. How do food systems interact with climate change coming along, Boyd?
Well, there is a huge potential for this, and we've seen with programs, school food programs overseas, that their procurement power is very, very high. And so if you are buying lunches for a country or for a city, you can influence the food supply and the food system. And they've done this places like Rome and Copenhagen. They say in 5 years' time, we're going to be buying this type of food, this organic food, or requirements, sustainability requirements. They might have requirements around the menus, more environmentally sustainable. So they can really make a shift if that's a determined approach. And this is another area where there is a lot of potential, but it hasn't really been realized or worked through for kauraka ako. But yeah, that's a big potential in the future.
Yeah, I think important. We have two questions more, which will probably take us to time. The first, I think we'll just go to, which has just come up, which is the pricing. And is there any potential for lowering the prices? The commercial providers, I understand, even though it's only 10%, I get paid a wee bit more than if it's just done in school. So is there any potential for squeezing the market, so to speak?
Well, yeah. Do you want to talk to that, Pippa?
Well, I don't think there's much margin in it. I don't think this is a very lucrative business for many of those large providers. I think that the potential for large-scale procurement, like what Boyd was talking about, that offers opportunity for perhaps some of the production for the school lunches locally to save costs. But I mean, you've got to produce food, employ people at the living wage, and drive that food to the schools for those external caterers who make up the majority. I don't know. I haven't asked them, but I feel like it would be a difficult ask to reduce the cost. It's actually gone the other way. The costs have increased so that we can really keep that quality high and not lower the quality of the lunches that the students are getting, which is a key part of uptake. If the lunches don't look appetizing for the student, and if they're not delicious, they're not going to be eaten, and they will be wasted. And we'll see those things that have been talked about in the media.
So I must say, to me, $5 this seems quite a reasonable cost for a healthy lunch. You're going to pay a lot more if you go and buy sandwiches in the main street. Let's go. I'm aware of time. We've got perhaps one more question. And one of the questions was about how are you going to get all this information in front of government before they make a decision?
Yes, that's a big one, Barry. And we have been trying very hard, I have to say. I've been sending emails and evidence and text messages and the works to ministers in charge and trying to get meetings with them to present this. We haven't had any offers for meetings with them, but you can be assured that all of the material is sitting with them. We haven't, I think it's a bit disappointing that they haven't wanted to engage with the evidence, since that is part of the coalition agreements, saying that they're going to be evidence-based here we've produced a ton of evidence and we're keen and willing to present it, but we haven't had that offer taken up, I'm afraid.
Okay. Well, let's hope there's a few MPs listening to this seminar, because it has been a extensive review of the evidence, and I must say it seems like there's very little that's actually negative. Pretty well all of it is positive. I'm especially interested in the mental health effects. 20% increase when we're seeing such a rapid increase in mental health distress amongst our youth at the moment, post-COVID and starting just pre-COVID. So I would be hoping that that particular issue is very much attended to by the people that are distributing our tax dollars. So look, I'm going to thank you all three for really an excellent presentation and hand back to Kawiti for finishing the seminar.
Thanks, Barry, and thanks again, echoing those sentiments to all our speakers and to our kaupapa today, mihi ana ki a koutou. Ka kapi ake I konei, ta tātou webinar, nā reira, unuhia ki te urutapu nui, kia wātea, kia māma, te ngākau, te tinana, te hinengaro, te wairua, I te arataka tū, ko iara e rongo whakairihi ake, ki runga, kia tīna, haumi e, hui e, tā iki e. Kia ora mai, everybody. Have a great day.